Listo. All right, we have 258 people entering, so we will. So we're starting now. Good afternoon and welcome everyone to our second NLAAD 2020 webinar. I am Luis Mares, the Director of Community Mobilization Programs at the Latino Commission on AIDS and coordinator of the National Latino AIDS Awareness Day since 2017. We're very excited to continue this year's series of webinars with a very important topic, social determinants of health, and how these factors have determined the impact of the HIV epidemic in the Latinx community. In the times we are living, another pandemic is affecting our lives, the COVID-19 pandemic, which is also affecting disproportionately the minorities and the communities of color in the same way that the HIV epidemic has done for many years. To talk about this important topic today, we have our amazing speaker, Greg Millet. But before continue, hold on a second. Before continuing with the webinar, we have a little housekeeping. This webinar is being recorded, and if you are not mute already, please silence your microphones. When you write your questions, write them in the question and answer chat box, not in the chat box, but in the question and answer section, so we can find them easier. The recording and the copy of the slides will be shared with you after the webinar. Okay, this is our 18th year doing NLAAD, organizing NLAAD in our efforts to create awareness among the Hispanic Latinx community about HIV and also supporting the Ending the HIV Epidemic plans. We ask you to promote our campaign by posting about it in your social media accounts and using the hashtag NLAAD2020, HIV Fingertips, and NLAAD. Earlier in the month of September this year, we launched our NLAAD 2020 campaign, and we share with you the posters of this year. This year's theme is at your fingertips. With this theme, we wanted to remind our community that the tools to end the HIV epidemic are our fingertips, that we have easy access to testing, that we know how preventing measures that work very effectively, such as PrEP, PEP, and the use of condoms. And also we have very effective treatment that improves the health of people living with HIV, reaching viral suppression and therefore also eliminating the risk of transmission through sex. Well, we know treatment as prevention, or we also know it as U equals U. Each one of these tools are represented in the posters that we have this year. With all these tools and measures, we can identify those living with HIV who do not know they have it. We can reduce significantly the risk of transmission, and we can prevent new infections. We also ask you to visit our website, nlaad.org. Browse it for information about the campaign and about HIV. But we also would like you to register your NLAAD event with us by clicking the registration link in our webpage. In this, the arrow is showing it. Once you click the link, we will take into another page where you will have to fill a survey with information about your event. You can also request support with ORA2 HIV test kits if your event is going to have HIV testing. Please fill both pages of the survey and then click submit at the bottom. Once we receive your registration, we will work immediately in coordinating your HIV test kits if you request them, and your event will be added to our page. If you have no plan an NLAAD event this year because of the COVID-19 restrictions, we ask you to consider virtual events where you can still deliver information about HIV and continue to create awareness about HIV in our community. Finally, before starting this webinar, we would like to invite you to join in our next two webinars. On October 14 at 2 p.m., we will have Advancing the Ending the HIV Epidemic initiative during COVID-19 times with Harold Phillips from the U.S. Department of Health and Human Services. And on October 22nd, we will have our last webinar, Undetectable Equals Untransmittable, the message of the movement, with two of the NLAAD U equals U ambassadors, Davina D. Corner and Arena Lins. For today's webinar, Social Determinants of Health and HIV in Communities of Color, as I mentioned earlier, we have Greg Millet. Greg Millet is a well-published and national recognized epidemiologist researcher with significantly experience working at the highest level of the federal HIV policy development at both the White House and the Centers of Disease Control and Prevention, the CDC. Prior to joining AMFAR in May 14, Mr. Millet served as the Health and Human Services CDC liaison to the White House Office of National AIDS Policy. Mr. Millet's work has been published in numerous peer-reviewed journals, including JAMA AIDS, Journal of Acquired Immune Deficiency Syndromes, and American Journal of Public Health, as well as other medical and public health journals. Prior to his tenure with CDC, Mr. Millet was a fellow in the HIV Bureau of the Health Resources Administration, a lecturer at Lesbian and Gay Health at Duke University, and Bowman Gray Schools of Medicine, and a board member of the Piedmont HIV Health Consortium. Mr. Millet is currently researching on the social factors that affect the COVID-19 epidemic, and he has a Bachelor of Arts degree in Dartmouth College and a Master of Public Health degree with an emphasis in community health education from the University of North Carolina, Chapel Hill. So with this, Greg, the floor is yours. Thank you for being with us today.
And thank you, Luis. I'm going to go ahead and start my video. I just wanted to thank again NLAAD as well as the Latino Commission on AIDS for the invitation today to speak. Let me see if I can go ahead and share my screen.
Thank you.
Let's see. Try it one more time. This is what happens when you are 52 and clearly not technologically advanced. I'm just waiting for my presentation to come up. Sorry, I'm still waiting for this presentation to come up. Okay, there we go. Okay, let's try it again. Let me share my screen one more time. And voila. So thank you again for the opportunity to present today. I'm going to talk about the social determinants of health in HIV as well as COVID-19 in communities of color. I mean, as many of you know, the social determinants of health have been a big issue in HIV for quite some time because it really underpins the degree to which all of us are at higher risk. HIV, see higher rates of HIV in Latino communities. Unfortunately, we're seeing the same thing with COVID-19. So there's a reason why history always is repeating itself. And we really need to get a better handle on exactly what is happening and what are some of the places where we can possibly intervene to keep this from happening. So in terms of just going into the epidemiology, I'm a former CDC scientist, and I'd like to really get into the data first. We already know that new HIV diagnoses among Latinos from CDC data, that there are differences by men and women, that most of the diagnoses by far among men are among men who have sex with men, with a smaller proportion who are injection drug users and people who inject drugs. With Latinas, we also know that most of the infections that take place each year is through heterosexual sex. With a slightly larger proportion who are people who inject drugs as compared to Latinx men. And we also know that there are trends that we're seeing in terms of HIV incidence. These are data that were reported by CDC, looking at data between 2010 and 2018, where you could see in the aqua lines for the Latinx population, that it looks like the trends are fairly equal. You're not seeing stars next to it like you see for whites or for African Americans showing either an increase or decrease. But I think that these data are really problematic in showing the data in this way because we're not necessarily seeing stability in the Latinx population by HIV incidence. And what I mean by that is that there are definite trends in specific directions when you took a look by men, by women, as well as by age group. And when we take a look by men, you could see that for African-American men between 2010 and 2018, that HIV incidence and new HIV infections pretty much stayed the same. They're elevated, but they pretty much stayed the same. For white men, you could see that there's been a decrease between 2010 and 2018. But unfortunately, what we're seeing for Latinx men is this consistent increase in HIV incidence between 2010 and 2018. And then for Latinas, we're seeing a picture that's somewhat different. We're seeing a decrease in HIV incidence for Black women. We're seeing it remaining the same for the most part for white women. And then again, the same picture of sort of the stability for Latinas as well in terms of HIV incidence between 2010 and 2018. And then by age, when we look at the Latinx population, and particularly when we're looking at Latinx men, because there's such a high proportion of HIV and a gender imbalance of HIV between male and female in the Latinx community, that you're seeing differences when it comes to age. So we're seeing actually a decrease among the youngest group of Latinx men of HIV infections between 2010 and 2018. But then we're seeing this increase among Latinx men between the ages of 25 and 34, which is really concerning because we know that those are really the prime years for HIV infection. At the same time, we're seeing stability in HIV infection between Latinx men between the ages of 35 and 44. And the picture is the same for Latinx men between the ages of 45 and 54. Now, this is an old slide, but I like to use it because it's really important to talk about how these lifetime risks of diagnoses are different for each group. We are very clear that Latinx women, that they are 4 times more likely to have a lifetime diagnosis of HIV compared to white women. And then we also know for Latinx men that there's a 22% greater chance of HIV compared to white men. But I think the thing that's really look at is the degree to which trans women, even though a small community, are disproportionately impacted by HIV. And that irrespective of race or ethnicity, that trans women who are white, trans women who are Latinx, trans women who are Black, have elevated rates of lifetime risk of HIV diagnoses. So again, to show that even though we see that diagnoses within the Latinx community is high, particularly among Latinx men, that you still see very high rates as well among Latinx trans women. Now, many of us know that President Trump last year during the State of the Union announced a plan to end the HIV pandemic. The plan is very much building upon the national HIV/AIDS strategy, but going a step further by building upon a lot of the efforts that have been taking place with community advocates all across the country since the release of the national HIV/AIDS strategy to go a step further and actually end HIV. The good thing about the plan that the Trump administration is doing is that it really does build upon a lot of the science. So they plan on scaling up HIV testing, needle exchange programs, pre-exposure prophylaxis, as well as treatment and linkage to care in those communities, those focused populations who are at highest risk for HIV, which include Latinx. Sorry, I'm just trying to change the slide. It's not allowing me to advance. There we go. But one of the quick things that you also learn too is that when you take a look at what's taking place in many of these communities, that we also have this concurrent pandemic that's taking place, where we're seeing high rates of COVID-19, particularly in those counties that are disproportionately Latinx. And those counties that are disproportionately Latinx on this slide are the orange and the dark orange slides. And when you actually compare them with the jurisdictions where we see that we have the EHE pandemic, there's a lot of comparisons that are there. So it's clearly something that we're going to have to deal with as we move forward with EHE, that this pandemic is really going to complicate our efforts in terms of COVID-19 in many different ways, but it's also highlighting a lot of the structural issues that we see that make Latinx populations at high risk for HIV. This is a slide that was looking at COVID-19 cases as of May 20th this year. And what they did that I think is really ingenious is that they looked at data across many different states that you can see here on the bottom. And then they compared, the proportion of Latinx populations that you could see in gray for each one of these states and compared it to the proportion of the population that was being diagnosed with COVID-19. So for instance, in Michigan, the Latinx population is about 5.2% of the population. At that time period, there were nearly 9% of COVID-19 cases. In Minnesota, the Latinx population was about 5.5% of the population, yet 22% of COVID-19 cases. Going straight down, say, to Kansas, the Latinx population was 12% of the population, but 50% of COVID-19 cases. So one thing that this slide really demonstrates is the degree to which the Latinx population continues to be overly represented in COVID-19 diagnoses data. And you see this consistently across different states in the US. And it's not just across some of the different states. There's a recent paper, an analysis that CDC announced, taking a look at those hotspots, those counties in the US that are disproportionately Black or Latino for hotspots of COVID-19 cases. And one of the things that they found were really high mean estimated differences in COVID-19. And what I mean by that is that here they saw a 30% difference, meaning that in those states where Latinos were, say, 20% of the population, they were 50% of COVID-19 cases. So there was a 30% addition to those particular hotspots and counties of COVID-19 cases compared to their respective share of the population. And in terms of what that meant for COVID-19 cases, particularly for Latinos in these hotspots where we're seeing high rates of COVID-19, is that they were 4 times more likely to be diagnosed with COVID-19 compared to the general population. So we're seeing that something that's taking place here, not only with HIV, but with COVID-19, where the Latinx population is being diagnosed disproportionate in some ways to their share of the population. And it's not just diagnoses for COVID-19, we're seeing the same thing for hospitalizations. There was a recent paper that was published in the Journal of the American Medical Association where they were looking at 12 states and race and ethnicity for hospitalizations for COVID-19. And they found that in 5 of those 12 states, that there were highest of COVID-19 hospitalizations in Latinx populations. So here in Oregon, in Rhode Island, in Utah, in Virginia, and in Washington state, you could see that the Latinx population eclipsed all other populations in hospitalizations for COVID-19. And it's not just hospitalizations, and it's not just adults, and it's not just the diagnoses among adults. Unfortunately, we're seeing the same thing play out for Latinx youth for COVID-19 diagnoses as well as deaths. The first 2 figures are figures that came out in a pediatrics paper recently, which found that Latinx children, youth, had the highest rate of COVID-19 diagnoses in a study that was done in the DC area. It was DC, Maryland, as well as Virginia. And what made matters worse is that when they took a look over a period of time of COVID-19 diagnoses in that area, they saw that the diagnoses were consistently higher no matter what week it was among Latinx youth compared to Black youth or to white youth. Now, after this study came out, it wasn't more than a week later that CDC released another analysis. And this was an analysis looking at all the youth who have died of COVID-19, and youth being less than 21 years old, between February 12th as well as July of 2020. Now, what they found is that 83% of those who died from COVID-19 who were youth of color. But I think the statistic that is really telling and important is to see that most of those who died were Latinx. About 45% of the youth who died between February and July were Latinx. So again, we're seeing this picture again of impact, not just in HIV, but in COVID-19, with even a far more impact in some ways with the COVID-19 pandemic, mainly because of other issues that are taking place, structural issues that are taking place. The other thing that's been reported pretty widely as well is the life expectancy of Latinx populations and how it has been decreasing because of COVID-19. And this is data from a paper that was taking a look at life expectancy between 1980 through 2020. And you can see this is the life expectancy for whites where it's going up. And then there's a slight decrease because of COVID-19. Compare that with the Latinx population, where you're seeing that life expectancy is increasing. It was always higher compared to other populations. But then look at what the effect of COVID-19 is going to be on the Latinx community. We're seeing this complete decrease in life expectancy, so much so that the life expectancy is closer to where the life expectancy is among whites, whereas beforehand, it was greater. And this is all because of the COVID-19 pandemic, which we know is influencing many things in the US, but it's also influencing the HIV pandemic. So taking a look at this slide and knowing that life expectancy is decreasing, how much worse do we think life expectancy is going to be for HIV positive Latinx populations? Now, we already knew that life expectancy for Latinx populations was poor. These are data from CDC and others looking at data from 2008 through 2011. And what they found is that Latinx populations were more likely to enter care late, more likely to discontinue treatment than whites, and that helped explain the higher than average years of lives lost for Latinx populations compared to other populations. And this here is taking a look at age of diagnosis. And this here is taking a look at the years, the average years that people might expect of lives lost, depending upon when you were diagnosed. Now, the green line is the Latinx population. And you could see that for individuals who are diagnosed at age 20, all the way to individuals who are diagnosed by age 80, that green line is higher. And what that means is that the years, the average years of lives lost for HIV positive Latinx populations are highest compared to Black or white HIV populations. So what I showed you previously for COVID-19, where the mortality rates are increasing among Latinx populations and where it's actually decreasing the lifespan for Latinx populations. So a lot of this really underscores the social determinants of health and the importance of the social determinants of health. And there are many different ways that we can look at this, but we know that it's been critically important in HIV. And there's been fantastic work that's been done in this area by many scientists. This is from a paper that was just released within the last couple of weeks by Nanette Bembo, where she was taking a look at those counties in the US that were disproportionately Latinx compared to other counties to see if there were any ways that they can try and explain some of the disparities that we are seeing for HIV among Latinx populations. One of the things that came out that were very clear were social determinants of health was really 4 different things. Now, the black line is the Latinx population in counties, the Latinx incidence. And this is the incidence, projected incidence that's taking place among whites in many of these counties. And you can see that as the proportion of Latinos living below poverty increased, that you saw an increase in the incidence rate, projected incidence rate for Latinx, whereas we're seeing a decrease among whites. They also found that percent of those individuals who didn't speak English or were not proficient in English, that you do see an increase in HIV diagnoses across those counties with whites. but the increase is steeper and higher for Latinx populations for HIV with not speaking English proficiently. They also found differences too in terms of, the different groups of Latinx populations that were inhabiting these counties. So as the proportion of Puerto Ricans increased in some of these counties, they actually saw that there was really no real decrease or increase for HIV among white populations. But look at here, you see an increase in HIV among Latinx populations as the proportion of Puerto Ricans in those counties increases. And then last, they also found that in the percent of injection drug use matters for those counties in the US and how it might explain some of the disparities. And you could see again that for whites, there was really no change as a proportion of people who inject drugs increased in those counties. But for the Latinx population, you see this really huge increase in the line for HIV prevalence over a period of time when you have an increase in people who inject drugs. Now, what this paper really underscores is the social determinants of health and the degree to which they're associated with HIV in communities of color, and here particularly in Latinx populations. And why it's important is because we can't just spend time just looking at risk behaviors. Risk behaviors are important. Risk behaviors definitely are the reason why people become infected with HIV. But there's structural help to explain why we consistently see Latinx populations at high risk for HIV, as well as higher risk for COVID-19 and other diseases. And if we don't deal with these structural issues, then we're at risk of not being able to actually end the HIV/AIDS epidemic. So I just want to go really briefly into some of the data that we have. The first is poverty. It's been well known for quite some time now that as the income of average households decrease, that we actually see an increase in mortality for any disease. And this is actually a diagram that I got from colleagues at National Institutes of Health. And you can see for those families where they were making less than $25,000 per year, that mortality rates were far higher compared to those families that were making about $33,000 per year, or those families that were making $50,000 a year, and then all the way down to those families that were making greater than $115,000 per year. So there's a clear association that we see in the literature over and over again between income and mortality. If you have lower income, then you have higher mortality. If you have higher income, then you have lower mortality. Now, we're dealing with not only the COVID-19 pandemic, but we're dealing with the COVID-19 recession. And that recession is placing Latinx communities at particularly high risk. These are data that were presented on NPR just a couple of weeks ago, where they're looking at race and ethnicity and the individuals who reported serious financial problems during the COVID-19 pandemic. And you could populates all other populations in reporting serious financial problems. If they have higher financial problems, then we're probably going to expect to see higher rates of all-cause mortality in Latinx populations as well. This is just another way of looking at those data. These are data from the University of Southern California, where they are basically polling individuals over a period of time from the very beginning of the COVID-19 pandemic through now. They're taking this poll every day on the degree to which people believe that they are at high risk of running out of money in the next 3 months. And this is really telling because you can see that for white populations from March through now, that it's a much lower proportion who believe that they are going to be able to run, that they're going to run out of money in the next 3 months. But when you take a look at Latinx populations, that's the orange here, you can see how high it is of individuals from the very beginning of the pandemic through now who believe that they're at higher risk of running out of money over the next few months. And it's not just in terms of how people work or where they work, but also the businesses that people have. These are data basically showing which businesses are expected to survive the COVID-19 pandemic and which ones are not going to. And the thing that's really telling is that you can see that immigrant businesses, that there's about 36% of them are going to be lost during the COVID-19 pandemic. And you could see the same thing for Latinx populations. About 32% were likely lost during the COVID-19 pandemic with the decline that we had in the economy in April. So you see that and you compare it with white-owned businesses where only about 17% were lost. So that is also something else have an impact on income. It's going to have an impact on health for Latinx populations. Now, these are more data showing how hard the recession is hitting the Latinx community compared to other communities. This is a graph that's taking a look at the 2001 recession, the Great Recession. That's the recession that took place when Obama first came into office. And then now the COVID-19 recession. And one thing that you could see is that the Latinx population is eclipsing all other races and ethnicities in terms of these recessions, but most importantly for the recession that we're in right now for COVID-19. And then one other thing that is important to take a look at is who in the Latinx community is being hit hardest by this recession. And these are data from the Economic Policy Institute, where the high spikes in unemployment between February and April of this year are among Latinx women, or among Latinas, where we're seeing very high rates of unemployment as compared to white men. So for instance, for white men, unemployment went from 2.9% to 12%. For white women, it went from 2.8% to 15%. For Latinx men, it went from 3.2% to nearly 17%. For Latinx women, it went from 5% to 20%. So about 1 in 5 in April of women who are working age, who are Latinx, were unemployed. And again, that has ramifications for health moving forward, not only for COVID-19, but certainly for HIV. And it's not just the jobs. We have to think about how many people are missing school or not able to enroll in school because either they or their families don't have incomes or jobs. And this was a story that ran in the Washington Post just a couple of weeks ago, where they're showing that low-income students are at highest risk of dropping out of college. And there's a quote from Rochelle Zar where she said, "I spent the last few months focusing on finding a place to live rather than focusing on school." And basically saying that, as her financial woes mounted, that she had to drop out of college and missing a semester and moving in with a friend, and no plans yet to re-enroll in college. Now, what does this mean, particularly for Latinx populations? If we know that having higher income is getting ahead in life is not only associated with better health, we have many low individuals dropping out of school because of the COVID-19 pandemic. What is that going to mean in terms of health for Latinx communities? And then just to put a finer point on it, these were a picture that went national and viral through Twitter of kids in Nevada who are sitting outside of a Taco Bell. These are young Latinx kids who didn't have access to internet at home, but still wanted to continue with their classes and education that was taking place online. But of course, we know disproportionately that communities of color are less likely to have access to internet at home. So these kids went to the neighborhood Taco Bell where they knew that they could get access and sat in a parking lot just to be able to get their schoolwork done. This is going to jeopardize for many Latinx populations the degree to which a new generation is going to be able to get ahead in the United States because of this COVID-19 recession that's taking place. It's disproportionately impacting Latinx populations. It's also probably going to mean that we're going to see a resurgence or even higher diagnoses of various diseases, particularly HIV, because of this recession. Now, of course, there's an issue of insurance and access to health insurance in the United States. Many years ago, when the continuum, the Cascade, looked very different, I was asked to give a presentation on some of the structural factors that are associated with the Cascade. And many of you recognize that this is an older Cascade of diagnoses and viral suppression. But this was part of the slides that I presented. And I went ahead and took a look at the scientific literature to see if I can find anything that was common in terms of poorer outcomes for various parts of the Cascade. And there were two things that were common: no health insurance and low income was associated with not being diagnosed. It was associated with not receiving care. It was associated with not being retained in care, and it was associated with poor viral suppression. So again, low income, which I just discussed beforehand, is associated with poor outcomes for people living with HIV. But we're seeing again the same thing too for access to insurance. And now, why this is important? It's incredibly important when we're talking about the ending the HIV/AIDS pandemic, particularly among Latinx populations, because when you take a look at the demographics of the ending HIV epidemic localities, you see that nationally, it's about 18% Latinx. But when you take a look at the 7 states that are targeted by EHE, about 6% is Latinx. When you take a look at the counties that are going to be targeted under EHE, 31% is Latinx. Now take a look at below, when you take a look at health insurance for individuals who are under 65. And you can see that nationally, those individuals who are lack access to health insurance, 1 in 5 who are uninsured in EHE counties for Latinx. So insurance access is disproportionately affecting Latinx populations, and that certainly has implications as well, not only for HIV, but certainly for COVID-19. Now, what makes matters worse is that over the last couple of years, we're actually seeing a decrease in insurance in the United States. So even though we had the Affordable Care Act that was able to add 20 million people to insurance in the US, we're now seeing a decrease between, for the first time in 10 years, from 2017 to 2018. And you can see it right here as well, that in Latinx populations, we're about 15% were uninsured, but by 2018, we're starting to see this increase. More importantly, taking a look at foreign-born individuals, where again, you see that about 17% were uninsured in 2017, and then that increased in 2018. We're seeing the same thing now for non-citizen foreign-born as well, where uninsurance rates were about 26% in 2017 and going all the way up to about 28% in 2018. And unfortunately, the same pattern is taking place as well for non-citizen children who are foreign-born as well, where they have higher rates of uninsurance that unfortunately is going up. Now, this also has implications again for EHE, because I told you that we have the 7 EHE states. 5 of the 7 have not expanded Medicaid, and that certainly is reflected in the rates of uninsurance in those states. You can see in the aqua bar that it doesn't matter what race or ethnicity these individuals are, that we see higher rates of uninsurance in the 7 states for EHE, and it's particularly high for Latinx populations. It's highest compared to all the other groups. And that for Latinx populations that nationally, about 20% are uninsured, but for the 7 included states, it's about 27% who are uninsured. So this has implications for EHE. This has implications for this COVID-19 recession that we're going into, where so many people are losing their jobs and where jobs are tethered for some people for health insurance, where we're going to probably see a lot of Latinx populations who don't have access to health insurance and are likely going to see an increase in HIV. Again, this is just making that same point, uninsurance and healthcare losses. When you take Black, Latinos, and as well as whites, you see that there's a Latinx populations who have employer-based insurance. You also see that there's a higher rate of uninsurance in Latinx populations. And when we take a look at what's taking place with the COVID-19 pandemic and the change, the estimated % change in people who have employer-sponsored health insurance coverage, you see that it's decreasing across race and ethnicity, but the decrease is highest for Latinx populations and for Black populations, where we're seeing drops in insurance that are employer-sponsored healthcare because of the COVID-19 pandemic. Now, another way that we could take a look at this issue of insurance is access to medications. Many of us remember that in 1996, when antiretroviral therapies became available, that we saw differences by race and ethnicity for many years in terms of access as well as even knowledge of antiretroviral therapy. And there's a paper that was published in 2001 by former colleagues at CDC where they compared whites with Latinos in knowing that a treatment exists for HIV that keeps you virally suppressed and extends your life. And you could see that it doesn't matter which demographic you see: male, female, marital status, age, education, income, geographic region, employed or not employed, ever or never been tested, that for Latinos, they were far less likely to know that any treatment existed for antiretroviral therapy that prolongs life as late as 2001. And it's across all demographics. They were, Latinx populations were less likely to know compared to whites. And we see, unfortunately, these disparities that are taking place still today. Now we have pre-exposure prophylaxis, but CDC is still saying that even though 25% of the Latinx population could benefit from PrEP, only about 3% have actually been able to access PrEP. And unfortunately, we're seeing history repeating itself as well for COVID-19, where we see that COVID-19 testing sites are being located in many different communities, but not communities of color. They're primarily being located in white communities. And this is just one of many examples, but this is an example that NPR had a couple of months ago, where they're looking at those sites in Texas. And you could see that for Houston, for Fort Worth, and then for Austin, that those communities that are primarily white or a higher percentage of whites, that sort of those pink communities, you see a greater number of many of these testing sites, again, in these pink places, in the pink places. Those sites that are primarily orange are communities of color. You're seeing fewer, much fewer COVID-19 testing places all over the place for each one of these different states. So it just goes to show again that in many ways we're repeating a lot of the same mistakes that were repeated with HIV, that the issues of access, the issues of knowledge, unfortunately, is taking place again with COVID-19 that we already saw with HIV. That's going to unfortunately not end well in terms of our ability to end the HIV epidemic. We also have issues in geography. There's been an explosion of, that's been taking place in terms of where the Latinx population lives in the US. So these are data from our website where we take a look at EHE data for various different types of variables. And one of them was to take a look at proportion of Latinx populations. And you could see that this is what was taking place in 2009. This is where the proportion of Latinx populations across counties, with the dark green meaning a higher proportion, the light green meaning a much smaller. Look what happened by 2018. Many of these places that were light green, we're starting to see actually fill in the Midwest with more Latinx individuals who are moving into those places. So we're essentially seeing this migration that's taking place in many of these different areas. We're also seeing geography influencing how disease for both COVID-19 as well as HIV. There's a paper that Carlos Rodriguez Diaz published recently. I had the privilege of being on this paper with him, where we're taking a look at COVID-19 cases as well as deaths in the US and looking at the heterogeneity of COVID-19 cases and deaths. And what he found is that it depends upon which region of the US that Latinx populations are in. And these are counties that have a higher proportion of Latinx individuals. And what you could see is that in the Midwest, as there were a greater proportion of Latinx individuals, you see a higher proportion of COVID-19 cases that are diagnosed. Same thing in the Northeast, as the number of Latinx population increased across counties, you see an increase in COVID-19 diagnoses. We didn't find that association in the South or in the West, but you see in the West that it was beginning to increase. These data were collected right in mid-May, before the data really started to crest in California and other places in the West to show increases. So you could see that that was going to take place. But it's clear that there are geographic differences in diagnoses of disease in Latinx populations, and particularly for COVID-19. We also found the same thing, taking a look at the degree to which a place is urban or not urban. And these are data actually for Latinx populations. So these are Latino cases. And you could see that for those cases were elevated in those counties that were in medium metro counties, small metro counties, close to rural counties, as well as rural counties, where you saw greater diagnoses of COVID-19. In terms of COVID-19 deaths, Carlos only found that in medium metro counties, there were elevated COVID-19 deaths. We didn't necessarily find that in any other types of urbanicity across the US. But it's interesting, again, to see that there are patterns in terms of where the cases are and where the deaths are. We're seeing these patterns right now in where I live in Washington, D.C. Where COVID-19 diagnoses are taking place. I live in Columbia Heights, which is a neighborhood where has a large population of Latinx communities. And you could see that COVID-19 diagnoses are highest in where I live in Columbia, as compared to other parts of the city, like Georgetown, which is much whiter, has a higher income, where you see very few COVID-19 diagnoses. So again, this issue of wealth and disease is something that's a structural issue that we see over and over again in terms of geography. And part of the reason that we see that is because of segregation. We see over and over again for many different types of diseases that where you live determines your health. We certainly have seen it for HIV, that for instance, in those places where there are counties where there are fewer whites, about 60% or less white, you see higher diagnoses across the US. In those counties that are 94% or greater white, you see fewer HIV diagnoses. And we see that over and over again in other data as well. There are data from Florida for several things that we're taking a look at rural residents for Latino individuals, where they saw greater rates of delayed diagnoses if you're in a rural residence. And as well, taking a look at neighborhood factors that are associated by where Latinos were born and how that was associated with different issues with HIV. And they found that residing in an area that was greater percent Latino, 50% or more, was associated with increased mortality. And in particular, they found that associations were higher for individuals who are Puerto Rican. It was 67% higher, as well as Mexican, 4 times higher risk if they lived in a place that had a greater number of Latinx populations. And a lot of that is not because that they are living in a place with greater Latinx populations. It's because those places are the places where there is less investment in communities, where there's residential segregation, where people are lower income, and you're going to see higher rates of disease. And just to put a finer point on it, we took a look at, again, these data, taking a look at those states that voted for Donald Trump and those that didn't. And we wanted to see if there were differences by proportion of white individuals and COVID-19 cases. And you could see that those areas that were more diverse, you see higher rates of COVID-19. And it doesn't matter if they voted for Donald Trump or if they were states that voted for Hillary Clinton. You see that in those states, those places that are more diverse, you see higher rates of COVID-19. Those places that are primarily white, that's the green as well as the gray, that throughout the pandemic, you see lower cases of COVID-19. Same thing for Hillary Clinton states, gray and green, the places that are primarily white, lower cases of COVID-19. So there is, this component that's economics, it's income, and it's also race and racism and segregation that determines not only COVID-19 diagnoses, but also HIV diagnoses by race and ethnicity. And there's a recent paper that was just published looking at Latino-White segregation and COVID-19 in different districts and counties across cities in the US. And as you could see, as the Latino white segregation increased, you see an increase in COVID-19 cases. As you see the increase in segregation again for Latinx and white, again, you see an increase in deaths. So this is something that is very clear. This structural issue of racism and segregation is associated with not only higher rates of HIV and poorer outcomes for HIV, but again, higher rates of COVID-19 and COVID-19 cases and deaths. Another social determinant, of course, too, is diversity of the community and language. And we know from many different data that just being a monolingual Spanish speaker is associated with late testing. These were data from Los Angeles where they said being a monolingual Spanish speaker was associated with late testing, that those individuals who were monolingual Spanish speakers were more likely to test during clinical screening, or rather to test as part of an emergency because they felt symptoms rather than clinical screening, and that late testers were more likely to get tested in a hospital rather than a public clinic. And they said that it's important that we have Spanish language speaking social marketing campaigns to really help reduce people getting tested late who are Latinx. We also see the same thing, unfortunately, with COVID-19. In the paper that Carlos Rodriguez-Diaz published, one of the associations with greater rates of COVID-19 was to be in a county with a higher proportion of monolingual Spanish speakers. And there was a recent paper that was just published in the Journal of the American Medical Association, where they found that compared to English speakers, those individuals who are non-English speakers had higher rates of COVID-19. And among the highest rates of COVID-19 were people who spoke Spanish. Monolingual Spanish speakers had higher rates of COVID-19 compared to other groups. So there's something else that's taking place here with this structural racism and the degree to which we cater our healthcare system to only people who speak English. And people who don't speak English have higher rates of HIV, poor outcomes for HIV, and higher rates of COVID-19. We also see the same thing in terms of place of birth and foreign-born Latinos and HIV diagnoses. This was a paper that was published looking at opportunistic infections and hospitalizations for foreign-born Latinos versus those Latinos who are not foreign-born. And they found that there were higher proportion of as compared to those Latinos who were born in the US. And this, unfortunately, is something when they did the regression analysis where they found that an immigrant was associated with 3 times likelihood of having an opportunistic infection as someone was just being diagnosed with HIV. And unfortunately, this is something we see over and over again. We see that at the US-Mexico border that 46% of Latinos are diagnosed late as compared to 37% of whites. In LA County, Spanish-speaking Latinos are 3 times more likely to present late for HIV compared to English-speaking Latinos. So there's something that's going on here that's a dynamic that we need to deal with. When we also see it in terms of country of birth. In Florida, there have been really great studies taking a look at differences within the Latinx community. And they found that the Latinos, those born in Cuba and South America, were significantly more likely to report HIV transmission as MSM as compared to people from the Dominican Republic who were more likely to say that they were heterosexual. Mexican and Central American Latinos were more likely to be diagnosed with AIDS within a month of HIV diagnosis compared to other Latinos. And HIV over time decreased significantly for Latinos born in Mexico and increased, but not significantly for those born in the Dominican Republic. They also, in another study, were taking a look at those individuals in terms of retention and care, and then found that Latinos born in Mexico and Central America were at increased odds of not being retained in care or not being virally suppressed compared to other Latinx populations. And those born in Guatemala and Honduras were at particularly greater risk, and that Mexican American as well as Central American Latinos had higher rates of non-viral suppression. And we see the same thing as well for other studies for HIV, where it translates into sexual risk and other risk as well. These are data from CDC, where they were taking a look at Latinx men who have sex with men, and they were comparing those who are US born, those who are established immigrants, meaning that they were here for greater than 5 years, and those who are recent immigrants. And you could see that those individuals who were people who were established immigrants were more likely to identify as gay, or US born were more likely to identify as gay. US born were more likely to have a healthcare provider that they could talk to about being MSM. But they found that those individuals who were recent immigrants had a greater number of male sex partners. Those people who were recent immigrants had a greater unprotected anal intercourse. And then you also see that in terms of visiting a healthcare provider in the past 12 months, that those people who are recent immigrants were far less likely than the other groups to visit a healthcare provider or to be tested for HIV in the past 12 months. So there's another dynamic there that is within the Latinx community, and as heterogeneous as the Latinx community is, that we all have to deal with. And unfortunately, the same thing also takes place with COVID-19. There's another paper that was published where essentially they found that Puerto Ricans in the Northeast, the Midwest, and the South were more likely to be diagnosed with COVID-19, and Central Americans in the Northeast, the Midwest, and the South were also more likely to be diagnosed with COVID-19. So we're seeing differences within the Latinx community. I think the other structural issue that we need to take a look at that affects disease is discrimination. Now, discrimination really helps determine where people work in the United States and how people work. And it's been very clear through the COVID-19 pandemic that Latinx populations are more likely to be essential workers than non-essential workers. And there's a paper that was published in Health Affairs where they were looking at individuals who were essential workers and unable to work from home, and it was highest in the Latinx population. And then when you see where many of these individuals work, they worked in food service and public safety, as well as in healthcare. And they found that the percent of households with at least one person who can't work remotely was highest in Latinx households. About 2/3 of households had somebody who could not work remotely, which means that it places them at greater risk for getting COVID-19 and coming into contact with people with COVID-19. And part of this is really, the structural issues of racism and discrimination. We know when you take a look at meatpacking industries that there were high rates of COVID-19 outbreaks that were taking place in these meatpacking areas. And there was a report by CDC to see which groups were at highest risk in these meatpacking industries for COVID-19, who comprised most of the diagnoses. And unsurprisingly, it was the Latinx population. And then when you take a look at what happened and why that was taking place, of course, we know that President Trump ordered for these meatpacking industries to stay open. You saw that there was a report from CDC that softened meatpacking safety during the pandemic and basically made it easier for people who work there to be discriminated against and to get COVID-19, as well as emails showing that meatpacking industry officials drafted the executive order for President Trump to keep these plants open. So we see a direct cause of these policies on COVID-19 in Latinx communities. The other way that we see some of the policies is the rhetoric that's coming from this administration and how it affects healthcare for Latinx populations, and particularly immigrants. There's a paper that was published looking at President Trump's statements and Latinx perceptions of safety and emergency care access. And those individuals who are undocumented, those individuals who are living in the United States, and those individuals who were legal individuals who were living in the US. And those individuals who are undocumented, you could see that, asking, have these statements made you feel worried or unsafe living in the US? A high proportion, over 30%, said that it made them feel unsafe. And a moderately high proportion, again, said it made them feel unsafe as compared to those individuals who were documentation or were legal residents of the United States. So these policies, this rhetoric is unfortunately has its effects. And we see the same thing too for homophobia as well as racism. There are certainly data that are out there that I'm not showing right now, that even in Latinx communities, there are differences in HIV infection by those individuals who are Latinx and Black, and compared to those who are Latinx and white, with higher rates of HIV for those who are Latinx and Black. For a study worked on while I was at CDC, we were looking at homophobia and racism by Latinx men who have sex with men and whether or not it was associated with HIV risk behaviors. And we found that it was, that those Latinx MSM who were exposed to both homophobia and racism were more likely to report unprotected anal intercourse with a casual sex partner. And unfortunately, we're seeing history repeating itself too, with Latinx workers facing discrimination over the spread of coronavirus and meat plants, where in many of these small towns, they were being told not to come to grocery stores. They were being ostracized by many of these communities, even though they really were the bread and butter for many of these communities and moving things forward. We see discrimination and racism as well in some of the policy that we have in the immigration policy. There's been 5,000 COVID-19 infections, and this was as of May, in detention centers in the US. But we're still seeing that of those places where they are sending tests for COVID-19, that ICE is not regularly testing people. And that's having, unfortunately, unfortunate impacts. There are 90% of ICE detainees close by in Virginia who tested positive for COVID-19. And we know that overall, this figure of 5,000 inmates being diagnosed with COVID-19 who are in ICE facilities is low. And that's because ICE is not regularly testing people. And there are people who are suffering and getting COVID-19 who are not being tested and likely not receiving the care that they need. We also know that racism was associated with the degree to which our decisions were to reopen the economy. We had a surge in the United States of COVID-19 cases in Texas, California, Arizona, and Florida over the summer. And it's not coincidental that those are states that had primarily or a large proportion of Latino populations, particularly people who could not stay at home during COVID-19. And we at AmFAR were able just to take a look at what were Latinx counties compared to all other counties looking like in terms of COVID-19 diagnoses in each one of these areas. And you could see that as soon as states reopened in California, that you saw an increase in COVID-19 in Latinx counties compared to all other counties in California. You saw the same thing in Florida with an increase COVID-19 in Latinx counties. Same thing in Texas as soon as we began to reopen. And quite frankly, the same thing nationally, where COVID-19 cases eclipse cases for Latinx counties compared to all other counties in the US. So we still went ahead and reopened the US, even though we knew that Latinx communities were disproportionately impacted, and we see the consequences of higher rates of COVID-19 diagnoses in those counties that were disproportionately Latinx. Now, we also see, unfortunately, the same thing with HIV. We know for HIV that if you're HIV positive and if you have a greater number of stressful events or traumatic events, that you are less likely to be adherents over a period of time, and that you are also less likely to be virally suppressed. And these are data from Michael Mugavero in University of Alabama, where they found that those individuals who are HIV positive, who had a greater number of stressful events in the last year, were less likely to adhere, less likely to be virally suppressed. Now, what this means in terms of the Trump administration and the degree to which it has targeted Latinx populations with policies that are incredibly problematic certainly has implications for us, because even though we're having this Ending the HIV Epidemic initiative that's targeting Latinx populations, another part of the administration is targeting Latinx populations with policies that are really disastrous, and policies that are going to keep people from getting into care, from staying in care or seeing a provider regularly. That is not going to end the epidemic. It's going to continue to increase the epidemic in Latinx populations. Now, there are some unknowns that we just don't know about yet. And that's because we're in a precarious place right now with COVID-19 and how it's going to affect HIV. One of the things that we don't know is intimate partner violence. We know that during the pandemic for COVID-19, that there's been a rise in intimate partner violence across the US. And you see in specific places such as Alabama, Portland, Oregon, San Antonio, Texas, and New York City, where there's been these increases in reported domestic violence. And why this is important is because even though I showed you data that for Latino women, that diagnoses for HIV were remaining stable, we know that for those women who were in situations where there's intimate partner violence, that they're less likely to adhere to medication, that they're less likely to be virally suppressed, and that we're probably going to see higher rates of mortality. You might even see higher rates of HIV infections taking place in this population. It's something that we need to take a look at to see if there's going to be any changes. We also haven't learned our lessons yet from the summer and which communities are going to be affected most by COVID-19. As I showed you the explosion that took place in Texas, Florida, and in California this past summer, Florida responded and actually tried to do things to try and address the epidemic slightly. Unfortunately, though, this week we're seeing Florida now reopening bars, completely reopening everything. And now we're also going to see reports of new spikes of COVID-19 cases that are taking place in Florida that are going to be disproportionately Latino. The other thing that we need to take a look at, we're not sure about, is the degree to which COVID-19 is expanding Medicaid in red America. You guys probably saw that Missouri, as well as Oklahoma, recently expanded Medicaid because of the COVID-19 pandemic. So many people were getting sick, and so many of these states are poor because of the pandemic that they've expanded Medicaid. And you actually see this increase that's taking place in COVID-19 deaths, where at first it was primarily in blue states. And now through September, we're seeing that the proportion has really shifted with more deaths that are taking place in red states. Again, here, you see that the proportion and number of deaths that's taking place is higher in red states compared to blue states. We have to wait and see whether or not that's going to bode for Medicaid expansion within those states, and whether or not it's going to be able to hopefully benefit those communities that are at highest risk for HIV. But irrespective of a state expands Medicaid or not, ACA still does not cover those individuals who are undocumented. And I showed you all these other data previously of differences for Latinos who are foreign born or not for COVID-19 and HIV, where those individuals who are foreign born fare worse in disease progression. And that's something that we have to continue to see as things move forward, and something that we need to address. Another issue as well, unfortunately, is vaccination overall. We know that vaccination for flu is important. It's particularly important now as COVID-19 cases are probably going to crest in the winter seasons that we're coming into. But unfortunately, when you take a look at vaccination coverage in the US, and this was actually a paper that was published by Robert Redfield recently, that it's fairly low for the Latinx population. For 2017, 2018, it was about 30% vaccination coverage. 2018, 2019, only about 40%. Given the policies targeting Latinx populations, given the COVID-19 pandemic, given issues in terms of being essential workers and not having access to getting out of jobs in a timely manner, we're still not sure if we're going to see an increase in vaccination for influenza, or if those rates are going to drop to even further to than where they are now. And then last, I want to leave you with the impact of COVID-19 on HIV funding. There's a paper that's coming out that's modeling the degree to which we're going to be able to end the HIV epidemic, but more importantly, who are we going to end the HIV epidemic with? And they're looking from 2020 to 2040 was their horizon. And they're comparing Black, Latinx, as well as whites on the timeline for when we're going to end HIV epidemic. So for New York City, you see very quickly that we're going to end the pandemic among whites by 2022 or so. But when you take a look for Latinx populations, they're not going to end the HIV pandemic among Latinx populations in New York City until closer to 2040, and it's still not even necessarily ending it. In Seattle, they did the same thing, and it finds the same patterns that for those communities that are white, they're ending the pandemic or the HIV pandemic very quickly by 2024 or so. But for Latinx populations, they're not ending it until many years later. 2030, 2032 is what these models are suggesting. So even though we have EHE, even though we're focusing on communities at highest risk, we're not going to end the HIV epidemic equally across all of these communities by race and ethnicity. And that's something that's very clear. Now, what does this mean in terms of the COVID-19 pandemic and the degree to which we're going to be able to have money to address EHE over the 10, even 20-year timeline for ending the HIV pandemic? And the problem is that when you take a look at SARS, H1N1, H5N1, Ebola, and the costs over 10 years to the US economy, all of those are dwarfed by what we see the cost is for COVID-19, which is about $9 trillion. We're going into debt because of an inability to really address and to prevent COVID-19 in the US that came from this administration and its poor response. How is that going to affect the response for EHE and ending the HIV pandemic, which this administration also says that it values? And I think it's very clear that the data here that we see these horizons of ending the pandemic later for Latinx populations, that now because of this debt that we're seeing, it's going to be even longer before we can end the HIV pandemic in the Latinx community. And with that, I just want to leave you with a quote of what's taking place with COVID-19 in perspective from a person who is living with HIV and how plagues change us. And he basically says that with these types of pandemics, that this will change us. It must. All plagues change society and culture, reversing some trends while accelerating others. The one thing that we don't know is whether these epidemics at some point, or one thing we do know is that these epidemics at some point will end. The one thing we don't know is who will we be by then. And to a certain degree, I believe that, and I agree that it does change us, but it mainly changes those of us who are forged in fire, those of us who are really in the trenches of these epidemics, both for HIV as well as COVID-19. The degree it changes those individuals who were largely unaffected by these diseases, I'm still not sure. But it's clearly our responsibility as advocates to make sure that we do as much as possible to end both COVID-19 as well as HIV within Latinx communities, irrespective of the budgetary issues and other issues that are taking place that's threatening the successes that we've had. Thank you for your attention and look forward to any questions that you have.
Thank you very, very much, Greg, with this amazing presentation. We have a lot of comments. If you can read the chat, there's a lot of positive comments. That's amazing. There's a few questions in the Q&A. Let's see. Let's start with Octavio Vallejo. He says, lack of health literacy, distrust the healthcare system, and access to misinformation in the internet are factors that preclude testing and contact tracing activities. Do you have any recommendations on how to overcome these challenges?
I agree with you completely. And unfortunately, my presentation, couldn't go into all the many factors that are also associated with lack of access to healthcare or certainly associated with greater rates of HIV. We definitely need to make sure that we begin early. We need to make sure that we have health literacy as well as literacy generally beginning early in schools. And unfortunately, right now with the COVID-19 pandemic, that's putting communities of color and their children behind compared to other communities. We need to make sure that in medical schools, that there are more Latinx doctors as well as doctors from other communities of color. Because you still see in medical schools that it's primarily white. And there's clear data that show that, people respond differently when they're being spoken to from someone from their respective communities. And we still haven't reached that point yet in the US. When you take a look at medical schools and the demographics there, and then you take a look at the demographics of the US, which is right now 40% non-white and increasing rapidly, then it's clearly something that we need to change. We also need to make sure that we change laws in some way, that there's some policies that are changed to really make sure that we get some greater equity in some of these areas. And I know that those were things that were proposed by many candidates during the primaries earlier this year. The degree to which we're going to be able to implement them, is really based upon all of us going out and voting so that we can have large enough margins, not only in Congress, but certainly with the White House, to try and pull together policies that can build in greater health equity and steps that we could take for greater health equity.
Thank you. Then Elvis Montenegro Leon says, hello. Many low-income Latinx people are low income and will most likely only have a cell phone. Does the calling poll also include calling populations who do not have landlines at home? I don't know if you mentioned something about this.
Yeah, I did take a look at, we were looking at data for COVID-19 and access to education for youth. But there's also data taking a look at, landlines, and I haven't seen any data for the degree to which people have landlines at home. I think that might be included in some census data, but I'm not sure. I know that we tried to take a look at it for some analyses that we took a look at, but we're able to get to it. Other people are able to get to it. But it's clear that you see these differences for not just landlines and availability of landlines by race and ethnicity, but also availability of cell phone service and the degree to which people even share. Just because you have a cell phone doesn't mean that it's your own dedicated cell phone. You see in communities of color that you see more people who share cell phones, and that has many different types of implications. It has implications for providers who might try to call you with results for various things and making sure that some of your data remain private within your community. And it certainly has implications to the degree that people can actually reach you for contact tracing in case you come into contact with somebody who are exposed to HIV or exposed to COVID-19, particularly if you're sharing your cell phones. So there's a lot of inequities that we need to deal with still in telecommunications.
Thank you. There is another question from Diana Penn. Does the public charge influence the issue with health insurance?
Does the public, pardon me? The public charge? Absolutely. Yeah, public charge, absolutely. I mean, the public charge is that it's a rule that this administration pushed forward that basically says that any immigrants who are not yet legal citizens who use anything that's part of the social welfare net, that's food for your children, accessing healthcare and insurance if you're sick, and other parts of the social welfare net. If you access any of that, that actually counts against you becoming a citizen in the US. And that's clearly a policy that is incredibly problematic. It doesn't make any sense. Specifically when you're also dealing with two infectious diseases. This administration supposedly wants to end HIV. This administration's in the midst of a COVID-19 crisis. If you are keeping people from actually healthcare, it is going to inability to become US citizens, then you're to not only infectious disease, but you're making health outcomes far worse and disparities worse in a community where the disparities are already high. So, again, we all need to do our best. We need to go out, we need to register, we need to vote so that you can vote in an administration that will not have this rule, that would actually get rid of this rule, and to make sure that we have greater health equity for Latinx communities and other communities at high risk for HIV and COVID-19.
All right, it's 3:17 already, so I want to thank you very much for this amazing presentation. There's a lot of data that you share, very important information in how these factors are impacting our communities. And I also want to thank everybody who attended the webinar, and I hope to see you all in the next webinar. Thank you very much, Greg.
Thank you. Take care, everybody.